Hi, I am Dr. Manisha Gupta, Professor and Head from the Department of Physiology at Santosh Medical College. Now I am discussing the topic ECG. Body is the volume conductor and the body fluids are the good conductor of the electricity because it contains large quantities of the electrolyte. Therefore, electrical changes occurring in the heart with each heartbeat are conducted to the all over the body, and it can be picked up from the surface of the body, and the record of these electrical fluctuations during the cardiac cycle is called the electrocardiogram. And if the electrode is placed so that the wave of the depolarization spreads towards the recording electrode, the ECG records a positive or the upward deflection. If the waves of depolarization spreads away from the recording electrode, a negative or the downward deflections occur. So, if the current flows in the same direction as axis of lead, ECG stylus is deflected strongly upward from the baseline of the lead. If the current flows obliquely to the axis of the lead, stylus is directed less strongly upward and its height varying with angle of the vector of current makes with axis. And if the current flows obliquely in opposite direction to the axis of the lead, stylus is deflected less strongly downward and its depth varying with angle that vector of the current makes with axis of the lead. If there is no current flow, then there will be no deflection of the stylus. And when in the electrophysiology, when myocardial muscle is completely polarized or depolarized, the ECG will not record any electrical potential, but rather a flat line that is called isoelectric line. After depolarization, myocardial cells undergoes depolarization to return to electrical state at rest. And now the electrical events of the cardiac cycle. What are the electrical events? First, the SA node is the normal pacemaker of heart that is located in the right atrium. There is the depolarization waves started from the SA node. It is originate in the SA node. So it spreads from the SA node across the atria and results in the formation of P wave. So P wave is due to the contraction of the atrium. P wave is formed due to the contraction of atrium. Three tracts within atria which conduct depolarization wave to the atrioventricular node. The conduction shows in AV node to allow atria to empty blood into the ventricle before the ventricular systole. The bundle of His connects AV node to the bundle branches, and Purkinje fibers are terminal bundle branches. Then, so the normal impulse conduction first from the SA node to the AV node to the then through the interventricular septum to the bundle of His, and then bundle branches, right bundle branch and the left bundle branch, and then to the terminal fibers is the Purkinje fibers. And the wave due to the atrial contraction is formed as the P wave, and due to ventricular depolarization or the ventricular contraction, the ventricular contraction QRS wave, and the ventricular repolarization, due to ventricular repolarization, wave is formed is the T wave. So, and in the ECG graph paper, ECG graph paper has two axes, x-axis and the y-axis, and the ECG graph paper, it runs 25 millimeter per second in the ECG machine. Its speed of running is 25 millimeter per second, and in the x-axis it represents the time. Therefore 1 millimeter equal to 0.04 second, and the y-axis which represents the voltage, and it's the 1 millimeter of at y-axis equal to the 0.1 millivolt, and any deflection of the record above the baseline is regarded as the positive deflection. It occurs, the active electrode becomes positive relative to the indifferent electrode, and any deflection below the baseline is regarded as the negative deflection, and it is seen when the active electrodes becomes negative. No deflection from the baseline means isoelectric line or the isoelectric segment. And now the 1 big square on the x-axis, it takes about 0.2 seconds, and 2 big squares on y-axis, it takes around 1 millivolt, and each small square is 0.04 second. So the ECG, the ECG runs at the rate of the 25 millimeter per second. The basic electrocardiographic complexes in which the P wave is formed, which represents the atrial depolarization, which causes due to the atrial contraction, and depolarization of atria not normally detectable on an ECG, and the excitation of the bundle of His and the bundle branches occurs in the middle of PR interval, and the QRS complex reflects the depolarization of the ventricle, and T wave reflects the repolarization of the muscle fibers in ventricle. So it is very important. What is PR interval? PR interval is the beginning of P wave to the end of R wave, and atrial, which consists of atrial depolarization and delay of AV junction, AV bundle, AV node and bundle of His, and the delay allow the time for the atria to contract before the ventricles contract. And the pacemaker of the heart, their main pacemaker is the SA node, which is the dominant pacemaker with an intrinsic rate of 60 to 100 beats per minute, and AV node, which is the backup pacemaker with an intrinsic rate of 40 to 60 beats per minute, and ventricular cells, which backup pacemaker with an intrinsic rate of 20 to 45 beats per minute. What is sinus rhythm? The sinus rhythm is the rhythm which is the beat which is generated by the SA node, which is the heart's dominant pacemaker. The ability of the focal area of the heart to generate pacemaking stimuli is known as automaticity. The depolarization wave flows from the SA node in all directions, and the AV The AV conduction is the AV node is situated on the right side of the interatrial septum near the ostium of the coronary sinus. When the wave of depolarization enters the AV node, depolarization slows, producing a brief pause, thus allowing time for the blood in the atria to enter into the ventricle. Now the P wave, it is the normal times taken by the P wave is around 0.204 to 0.12 seconds, and the PR interval, which takes around 0.20 seconds, and Q interval, which is less than 3 millimeter, and it is around less than 0.04 seconds. And R wave is the ventricular which represents the ventricular contraction, which is around not more than 25 millimeters. And S wave is the complementary to the R wave, and ST segment is the isoelectric segment, and T wave represents the ventricular repolarization. And now the interpretation of the ECG. And the first measurement to calculate the heart rate, PQRST waves, represents one complete cardiac cycle. At standard paper speed, divide 1500 by distance between RR wave, and the ECG machine can run, because the ECG machine can run at the speed of 25 millimeter per second. So it runs in 1 minute 25 into 60 equal to 1500 millimeters, because in 1 minute 1 second it runs 25 millimeter, and 1 minute 25 into 60, then there is 1500 millimeter runs in 1 minute. So heart rate is equal to the RR interval is divided by 1500. So we can calculate the heart rate. So heart and standard ECG recorded in 12 leads. Out of 12 leads, there are 6 limb leads and 6 chest leads. 6 limb leads, in which the 3 are bipolar leads and 3 are unipolar limb leads. And 3 unipolar limb leads are called unipolar limb leads are also called the augmented limb leads. And there are 6 chest leads. Chest leads are V1, V2, V3, V4, V5, V6, and 6 bipolar limb leads are lead 1, lead 2, lead 3. And lead 1 is placed between the right arm and the left arm, is the bipolar leads. In the right, and the lead 2, bipolar lead 2 is placed between the right arm and left foot. And lead 3, bipolar lead 3 is placed between the left arm and left foot. So there are 3 bipolar limb leads and 3 unipolar limb leads. Unipolar limb leads are the augmented limb leads, also called augmented limb leads are the AVL, AVF, AVL, AVR, AVF. AVL, which are placed in the left arm, AVL are placed in the right arm, and AVF, which are placed in the left foot. And now 6 chest leads, which are placed in the on the right side, and V1 is placed on the fourth intercostal space on the right sternal border. Then V2, fourth intercostal space in left sternal border, and V3 is after V2 we place the V4 on the fifth intercostal space in the mid clavicular line, left mid clavicular line, and V3, then we place the V3. V3 placed equidistant between the V2 and V4, and V5 is the it is placed on the fifth intercostal space in the left axillary line, and V6 is placed in the fifth intercostal space in the left mid axillary line. So we place all the 6 leads, and so the lead V1, V2, it represents mainly the right side of the heart, and V6 and V5 they are mainly represents the left side of the heart, and V3 and V4 mainly the basal part of the heart. And since the standard limb leads, lead 1, lead 2, lead 3 are recorded of the potential difference between 2 points, therefore deflection in each lead at any moment indicate the magnitude and direction in the axis of electromotive force generated in the heart. This is called the cardiac vector or the cardiac axis. Thank you.